going to be talking about organizations that help shape the community. The focus is, and there's going to be two parts to this lesson. The first part I'm putting right here on a YouTube video so you can kind of get your heads wrapped around it. The second part is I'm going to have you drill in class into looking at different agencies and what they do. Now, this second activity is going to be off on your own. This first activity, I want you to get your heads wrapped around two things. I want you to understand what private, federal, and state and nonprofits are, the different roles. I'm going to talk a little bit about federal and state. And then I'm going to start moving on to the part of where each of these agencies play a different role and how they work with state and federal agencies. So before we dive into that, I really want you to understand the history of public health, and that it goes back into really looking at the diseases and how they came into different areas. And what started happening is that we started seeing groups of population live in some really environmentally areas that kind of put people at risk. So poorly drained coastal areas put people at risk for cholera and yellow fever. So they started to have to think about what the environment was like and how people were living. And then urban diseases like smallpox and tuberculosis were very much infectious disease, and they would spread. So each of these were things that people had to really think about. And average life expectancy was short. So what they started to do in colonial America, and they started to implement rules and regulations and start creating organizations and governances that oversaw these different areas. Quarantines were basically looking at limiting and restricting people within an area or restricting a person into an area. This is different than isolation. Isolation is completely remove somebody. But quarantine is restriction. They started looking at inspection of ships and sailors as they came in. So for example, if a ship came in and it had smallpox, they would say, you can't come into this harbor. You can't come in. Or let's say there was some disease with an animal or some kind of fruit or vegetable, they would start to limit that. They would also look at nuisance abatement. Nuisance abatement basically means getting rid of something that could cause a disease. So nuisance abatement could be a rat or a mouse. We start realizing that there are vectors, and I'll go into this in infectious disease, but there are vectors that are things that actually carry diseases around, infectious pathogens that could cause a disease, something that could cause a disease. So rats, mosquitoes are things that could cause, and so they started abating these, getting rid of them. And colonial governments sometimes had to use draconian public health powers. Draconian means dictatorship, means sometimes taking the individual rights and putting them aside and using something called policing powers that I will definitely go into. So you need to realize that there's something in the Constitution, the 10th Amendment, and I'm going to go over this in detail in class again, but it really limits, in the United States, it really looks at the role of the federal government. This is the United States government is federal, okay? And then state. Federal powers are interstate commerce, anything that goes between the states, anything that moves between the states, any business that happens between the states is with the jurisdiction of federal powers. Anything that involves international trade and travel is federal. And anything to do with a war or, anything to do with war is federal power. State powers are powers not given to the federal government. They are pushed to the state. And in the United States, this is really something that governors and states are in charge of their area, and they have something called state powers. And they have the right to do something called policing powers, where they are able to police and oversee things within their state. This is something that is really within the Constitution. And yes, sometimes the federal and the state will have conflict. And this is where the courts will come in and they'll decide this. But know that this is the reason why things are set up the certain way in our public health system. And we will be going over that in class. But this is done by the 10th Amendment. If you want to read up on this, the CDC, the Center for Disease Control, if you Google Center for Disease Control, 10th Amendment, and federal and state, they have a whole entire module teaching this. There is whole classes dedicated to this called constitutional law. I will not go into it, but please know that even as I teach this class in the past, I have watched the president and the governors have debates over this. So it is in the Constitution. It reserves the clause. Since health is not mentioned in the Constitution, primary responsibility of public health belongs to the states. Okay? So the state is in charge of their public health area. And then the federal government oversees public health between the states. So when you look at this historically, while modern health officers must be educators and statesmen, rather than merely being a police officer, many of their duties are still necessarily concerned with law enforcement. Health officers, this is your local health officer, must be familiar not only with the extent of their powers and duties, but also with the limitations imposed upon them by law. This is from 1947 CDC Public Health Law. So as I go over the different roles, you need to always be asking yourself, is this a federal agency? Is this a state agency? What is their role? And a public health person needs to understand and navigate that. You, as a citizen, need to understand that too, if it's federal or state. And so one of the big things is that the state has this ability. Powers exercised by states to enact legislation within the state. So that means that they have the ability to do shutdowns of areas. The health officer can shut down a restaurant within a local area. A governor can shut down a state and mandate and do regulations. They have the ability to do public welfare and morals to promote the common good. So, for example, policing powers. This is from the Center for Disease Control. They have the ability to investigate an infectious disease outbreak. They have ability to set childhood vaccination laws for their state. They have ability to ban distribution of free cigarette samples in areas around schools and other places. They have the ability to involuntarily detain a person with certain communicable diseases, for example, tuberculosis, COVID-19. They have the ability to seize and destruct controlled toxic substance threats. So, for example, if there is something called spice, for example, they could set regulations to shut down an area that is using toxic or creating toxic substances. This is called policing powers. This is in our Constitution and is considered a part of the Constitution. And so this is the U.S. Constitution and public health. Term public health not mentioned. You can look at this. It's in there and it's the 10th Amendment. So when I ask you, where is it in the Constitution that the state has authority to do these things at a state level? It is the 10th Amendment and it's part of the Constitution. So when I talk about the 10th Amendment, and if I ever talk about policing powers, it is the ability for a state or local agency to come in and do these sanctions. They involve preventing a person from harming themselves, defending the interest of a person who's incompetent, such as a child or mentally disabled person, or protecting a person from harming themselves. So that's another role of policing powers. So I'm going to end with this. And then when we meet in class, I'm going to ask you to start looking at different roles. In the U.S. healthcare system, we have public financing and we have private financing. What I'm going to be talking about when we meet in class next is I'm going to be talking about the federal government and the state government. Do you see how this line puts them at the same level? The federal government has agencies that are under them. For example, the Center for Disease Control, National Institute of Health, and Federal Drug Administration. You also see other agencies like Health and Human Services. They are right here. Do you see this? And they are right under the federal government. And I think when you trace this line, you see them right here. The Department of Health and Human Services has the CDC, NIH, FDA underneath them. So you'll see that there's this connection that's happening. Then you'll see Medicare and Medicaid services. You'll see Medicare, Medicaid. So the federal government is this area. The state government also has agencies that go underneath it. So I just want you to see that if you sometimes see the federal government and the state government, they'll be talking about what they have jurisdiction over, and then they have agencies that report directly to them, and then we're going to go over the state too. We're going to stay on this side. I'm not going to be talking about the private financing until later on, and like way later on, like the end of the term, semester, whatever part of we're just going to dive into that later. But right now we're going to be talking about public financing. So I leave you with this question. What gives the state policing powers? The 10th Amendment. What does the federal government actually have charge over? I mentioned this at the top of the lecture. You should have answered anything with intercommerce going between states, anything with war, anything that involves something moving between the states. Okay? What does the state government have charge over? They have charge over anything that has to do with public health within their state. Now, can you think of federal government agencies? Before we meet, can you look up CDC, NIH, HRSA, HAHRQ, FDA, and can you think of other federal agencies? And then at the very bottom, I would like you to look down here and then see non-government agencies. Can you think of some non-government, non-profit foundations, organizations that could fit in here? All right, that's it for this lecture. Please look at your book, Chapter 2, specifically with an introduction to public health. And please look at the materials posted in the module so that you're ready for class when we meet or for the activity that is next. All right, that's it.